Hi guys! Today we're talking about gout. What is gout? Gout is an inflammatory type of arthritis that is caused by crystals which form in and around the joints. Gout occurs in people who have high levels of uric acid in their blood. Uric acid is a normal body waste product. It forms when chemicals called purines break down. Purines are broken down into uric acid, which 2/3 of it excretes in urine and the remainder gets eliminated through the gastrointestinal tract after degradation by colonic bacteria. You can get hyperuricemia from overproduction or underexcretion of uric acid. Overproduction is caused by 1. Abnormalities in enzyme systems that regulate purine metabolism, 2. Synthesis or deficiency of hypoxanthine guanine phosphoribosyl transferase, 3. Increased breakdown of tissue nucleic acids. And underexcretion of uric acid is caused by kidney disease or drugs like diuretics, nicotinic acid, salicylates, ethanol, pyrazinamide, levodopa, ethambutol, cyclosporine, and some cytotoxic drugs. And now we talk about the signs and symptoms. Acute gout attacks are characterized by a rapid onset of pain in the affected joint, followed by warmth, swelling, reddish discoloration, and marked tenderness. Areas that are affected. Gout mostly affects the big toe. Other joints that can be affected include ankles, knees, wrists, fingers, and elbows. And now onto the risk factors. Obesity, excessive weight gain, especially in youth, moderate to heavy alcohol intake, high blood pressure, and abnormal kidney function are among the risk factors for developing gout. Certain drugs and diseases can also cause elevated levels of uric acid. Also, there's an increased prevalence of abnormally low thyroid hormone levels, also known as hypothyroidism, in patients with gout. How is gout diagnosed? Gout can be diagnosed either by blood sample or joint aspiration. And now we discuss the treatments. For acute gout, the non-pharmacological therapy includes local ice application. Local ice application is the most effective adjunctive treatment. Dietary supplements are not recommended. And the pharmacological therapy, most patients may be treated successfully with NSAIDs, corticosteroids, or colchicine. NSAIDs have excellent efficacy and minimal toxicity with short-term use, started within 24 hours of attack onset. Indomethacin, naproxen, and Sulindac are FDA approved for gout. Selective COX-2 inhibitors like celecoxib may be an option for patients who cannot take non-selective NSAIDs, and cardiovascular risk must be considered. Corticosteroids have the same efficacy as NSAIDs. They can be used systemically or by intra-articular injection. Systemic therapy is necessary if attack is polyarticular, meaning when it affects more than one joint. Colchicine is highly effective only within 36 hours of attack onset, because likelihood of success decreases substantially if treatment is delayed. And here you have a chart for the appropriate drug selection depending on the intensity of pain in acute gout attacks. For hyperuricemia, the non-pharmacological therapy includes losing weight and exercising to enhance renal urate excretion, alcohol restriction, limiting consumption of high fructose corn syrup, and purine-rich foods. And the pharmacological therapy, the first-line therapy is xanthine oxidase inhibitors, and the alternative is probenecid. In refractory cases, the combination therapy with xanthine oxidase inhibitors and a drug with uricosuric properties like probenecid, losartan, fenofibrate. And here you have a chart of the medication for hyperuricemia. Patients with gout might also develop these diseases. Uric acid nephrolithiasis occurs in 10% to 25% of patients with gout. Acute uric acid nephropathy, chronic uric acid nephropathy, and TOFI, which is the late complications of hyperuricemia. And that brings us to the end of our video. Thank you so much for watching. For more information, you can click the description. And while you're already here, make sure to subscribe and share with your friends.